Hello, everyone. Today we will be talking about cardiac risk factors. And what will we learn today? We will learn about non-modifiable and modifiable cardiac risk factors and how we can reduce our risk of having another cardiovascular event. So there are risk factors you cannot change. These are non-modifiable risk factors. You cannot change your age. You cannot change your sex at birth. Before the age of 60, men have a greater risk of developing cardiovascular disease. And then after menopause, women have similar risk to men. Your family history, if you have a close blood relative that has had cardiovascular disease at an early age, you may be at increased risk. And ethnicity, those folks with African or Asian heritage or Aboriginal populations are at a higher risk of developing cardiovascular disease. What are some risk factors you can control and you can change? These are modifiable risk factors. That is smoking, high blood pressure and high cholesterol, physical inactivity and obesity, prediabetes, diabetes, and diet. We know that only 25 to 50% of Canadians are getting enough physical activity to maintain heart health. We know that physical inactivity is associated with an increased risk of heart disease, obesity, dementia, type 2 diabetes, high cholesterol levels, and high blood pressure. Remember that any exercise is better than nothing. Our wonderful kinesiology team will be doing some further education with you on exercise, targets and goals, and exercise progression. Often people with high cholesterol have blockages in their arteries, not only in their heart, which is coronary artery disease, but they can have blockages in the arteries leading to their brain and in their lower body. We have targets for people with coronary artery disease, targets for good and bad cholesterol, and I really encourage you to find out what your numbers are and if you are at target. Certainly some folks are at higher risk of developing or redeveloping coronary artery disease. So those folks, we want to have lower targets. We can improve our cholesterol levels not only by taking a cholesterol medication daily, but by eating a heart healthy diet and through exercise. High blood pressure damages the wall of the arteries and puts you at risk of developing or certain arrhythmias, and does make the heart stiff if you have high blood pressure for a long period of time. Blood pressure targets are individualized based on why you're here at cardiac rehab. Certainly for most people with known coronary artery disease, our target blood pressure should be less than 120/80. And again, we can lower blood pressure with medications, but we also can lower blood pressure with diet changes, monitoring our salt intake, exercising more, and losing weight. For people living with diabetes, physical activity, weight loss, and diet changes can help control your blood sugar levels. And for those folks without diabetes, physical activity can reduce your risk of developing diabetes by up to 50%. For those of you with diabetes, there are some diabetic medicines that are also protective of the heart and kidneys. If you're not sure whether you're on one of these medications, please book an appointment with the nurse practitioner and she can review your diabetic medications. Extra fat around your waist is mainly what's called visceral abdominal fat. And this changes how your body uses fat and sugar, can put you at an increased risk of developing coronary artery disease, diabetes, and certain types of cancer. If you do want a comprehensive assessment, please be sure you're booking an appointment with our dietitian. There will be a separate education on stress and the heart, but we know that stress, poor mental health, and poor sleep can put people at risk of developing heart disease, heart failure, and certain arrhythmias. If you are unsure whether you have sleep apnea, which occurs if you snore a lot at night or wake up gasping for breath at night, have an unrefreshing sleep, please talk to your family doctor or the nurse practitioner in this program about getting a referral for a sleep study. And if you do and are suffering from mental health challenges, please seek the support of your family doctor or book an appointment with our nurse practitioner to help you find community resources to help. And lastly, we know that alcohol is related to many health problems, including heart disease, arrhythmias, and certain cancers. So we do recommend abstinence or a maximum intake of 1 to 2 standard drinks per day for men, or 1 standard drink per day for women. Smoking does damage the arteries of the heart and the lungs and makes the heart work harder. If you are contemplating quitting smoking or want more information, we have a respiratory therapist who does smoking cessation counseling in our program, and she can help you quit. I know this is a lot of information and it may seem overwhelming, but small changes can make a big difference. Thank you very much.